Hi, I'm Dr. Ramirez from Little Flower Children's Clinic. If you're a new parent for the first time or maybe for the fifth time, there's probably a few things that are unique to newborns that you might have to contend with. And one of them is spit-ups. Now, spit-ups, they're a common problem that probably affect half of all newborns. But how do you tell if it's something normal or abnormal? How do you know when you need to go to your doctor or your pediatrician? First of all, spit-ups often happen after a baby is fed, whether he is breastfed or formula fed. And a common spit-up looks just like a small dribble. It's usually no more than 1 or 2 tablespoons of milk that come out. Usually your baby looks relaxed, is not choking, doesn't change colors, and just continues to feed normally. Now, how do you tell if it's spitting up or vomiting? Now, vomiting tends to be a lot more forceful. It tends to be repeated. So you might see, for example, that your baby vomits, and it's a type of projectile where he throws up at a distance and he continues to do it. With the spit up, your child is otherwise okay. But if your child is vomiting, he may look sick. He may have a fever, or there may be other symptoms. Why do babies spit up? Well, there is a muscle that controls the opening of the stomach that's at the bottom of the esophagus. And when we swallow, that muscle relaxes, it opens and allows food to pass through, and then it's to close. In babies, that muscle is still very immature. So after feedings, it may remain open, and as the baby's stomach begins to digest and contract, food may come back up. If you overfeed your baby, that may be another reason. If his stomach is too full, he may have a tendency to have more spit-ups. And if you bottle feed your baby, depending on how vigorously your baby eats, he may be swallowing air, or if he uses a pacifier, he may be swallowing more air that causes his tummy to get distended and then have more spit-ups. Well, what can you do about spit-ups? Well, a simple thing is to make sure that you burp your baby. Now, all of us think about babies burping them over your shoulder, but putting them over your shoulder can actually put a lot of pressure on their stomach and cause them to spit up even more. So it would be better to sit up your baby and to gently rub or pat their back for a few minutes after feedings. You might burp your baby halfway through the feeding and then again at the end of the feeding. Yeah, positioning is very important. You want to avoid feeding your baby while he's horizontal or laying down. You want to always try to sit him up, again, so that milk is able to sit in his stomach, assisted by the force of gravity, and there will be less of the spit up. If your baby is bottle fed, you might try experimenting with maybe some different nipples that release milk at different flows. You might even consult with your pediatrician, because occasionally you have a baby who may have a sensitivity to either something in the breast milk, which may be from mom's diet, or the type of formula that he is taking. But make sure you check with your pediatrician for that. When do you consult your pediatrician for spit-ups? Well, if your baby is coughing, choking, wheezing, turning blue or turning very red after these episodes, you definitely want to check with your pediatrician. If your baby is having problems gaining weight, then you want to see your pediatrician as well. If you see that your baby is very fussy after feedings and the fussiness is prolonged and not easily consoled, then check with your pediatrician as well. Yeah, the newborn period, it's a wonderful time in a parent's life and a family's life, but it can come with a lot of stresses. As a pediatrician, you have an advocate, somebody who is trained in the conditions and development of a newborn. So make sure that you take advantage of your pediatrician and ask him for advice. Always consult your pediatrician before you check online, before you check the net, or consult artificial intelligence. Remember, your pediatrician has specialized training and years of experience, and we're more than happy to help.